Hello, doctors. This is Dr. Baliga. This podcast belongs to a group of 11 podcasts on asthma, derived from an outstanding chapter in Baliga's textbook of internal medicine, available at www.mastermedfacts.com. It's authored by Dr. Christopher H. Fanta, MD, who is the director of the Partners Asthma Center, a collaboration of allergists and pulmonologists at the Brigham and Women's Hospital and Mass General Hospitals and affiliated community hospitals in the Boston area. He is a member of the Pulmonary and Critical Care Division at the Brigham and Women's Hospital and a full professor of medicine at Harvard Medical School. He is the co-author of the Harvard Medical School Guide to Take Control of Asthma, published by Simon & Schuster in 2004, and the Asthma Educator's Handbook, published by McGraw-Hill in 2007. After listening to this series of podcasts, the listener should have a solid foundation on the topic of bronchial asthma. Multiple choice question. A 32-year-old woman with manic depressive illness and a history of asthma presents to the emergency department with shortness of breath and loud expiratory wheezing, readily heard with the stethoscope. On auscultation, her wheezing is loudest over the neck and upper thorax. She has minimal improvement with inhaled beta agonist bronchodilators and systemic corticosteroids. Her chest X-ray is normal. Her transcutaneous oxygen saturation while breathing air is 97%. She is unable to cooperate with the lung function measurement. Chest and neck computed tomography are normal. A useful next step in her evaluation is A. Methacholine bronchoprovocation challenge, B. Fiber optic laryngoscopy, C. Echocardiogram, and D. Chest CT angiogram. And the answer is B. Fiber optic laryngoscopy. Features suggesting possible vocal cord dysfunction syndrome in this patient are upper airway sounding origin of her wheezing, her failure to respond to appropriate anti-asthmatic medications, and her history of psychiatric disease. This diagnosis is best further explored with direct laryngoscopy. Inappropriate adduction during exhalation of structurally normal vocal cords leave only a small posterior chink for the passage of air would confirm the diagnosis. The patient is unable to perform spirometry and would be unable to comply with their repeated spirometric tests of a methacholine bronchoprovocation test. An echocardiogram might be appropriate where congestive heart failure is strongly suspected. A chest CT angiogram would be helpful if the history pointed to pulmonary embolism as a cause of wheezing. This podcast was derived from an outstanding chapter on asthma authored by Dr. Chris Fanta, MD, who is a professor of medicine at Harvard Medical School, and he's the director of the Partners Asthma Center, a collaboration of allergists and pulmonologists at the Brigham and Women's Hospital and the Mass General Hospital and the affiliated community hospitals in the Boston area. He's the co-author of the Harvard Medical School Guide in Taking Control of Asthma and the Asthma Educator's Handbook. This chapter was derived from Baliga's textbook of internal medicine, available at www.mastermedfacts.com. After listening to the 11 podcasts on this topic, the listener should have a solid foundation in asthma.